Okay, so we'll be moving on now to our next speaker, which again, I think every speech is important. Don't get me wrong, but again, this is something that I think is incredibly important. Breaking the regional barrier and advocating for mental health supports outside of the city. Joe Fitch, identified as he/him, is a senior advocate with PWdWA, living and supporting in regional WA. With lived experience of PTSD and ABI, Joe supports people with disabilities to navigate complex systems and advocate for their rights. He's passionate about mental health, self-advocacy, and building inclusive communities beyond the city. Welcome, Joe.
Good morning, everyone. Well, it'll be afternoon for some of you, but it's morning for me in WA. I'd like you to imagine for a moment living in a place where reaching out for mental health support isn't just difficult, it's almost impossible. And that's the reality for many regional Australians, including myself. As has already been said, my name is Joe, my pronouns are he, him, and I live with PTSD. Today, I want to talk to you about what mental health looks like outside of the city and why so many of us are still falling through the cracks. As a mental health consumer in the country, I've faced bias, bureaucracy, and barriers at every step. It took years and thousands of dollars just to get a diagnosis. And today, to access the medication I need, I have to travel 260 kilometres each month. That doesn't include time for my therapy, specialist care, or any crisis support. And I'm one of the lucky ones who can make the trip. Many can't. We're living through the same cost of living crisis as the cities. But out here, the impact hits harder. Fuel is expensive. Groceries are limited. A loaf of bread in some towns costs $7. Rent in regional Australia now averages $550 a week, if you can find a house. Some towns have vacancy rates below 1%, which means less than 1 in 100, and some towns don't even have 100 houses. I've lived through what that means. My family nearly became homeless after our rental property was sold. We had the money, there just weren't any homes available. We were really lucky and a friend stepped in last minute. We found a place. But that's not a solution. That's survival by luck. Too often our regional mental health is framed as a suicide problem, but we need to ask why those numbers are so high. In 2008, my father took his own life. He was a farmhand. He was proud. He was private. And he was isolated. He never asked for help. In his world, you didn't talk about mental health. You worked, you drank, you kept going. And if you couldn't, you didn't say a word. At the very end, he tried. He reached out, maybe for the first time in his life. But his final text message wasn't received until 3 days after he died because of the regional issues with our telecom network. It came too late. His story isn't unique. And his death taught me this. It's not just about access. It's about trust. It's about people being failed by systems that are supposed to help. Access and affordability are still major hurdles. Yes, telehealth is improving access, but it assumes that you have things like the internet, a device, and privacy. After you close the laptop, who checks in? Where's the follow-up? Who makes sure you're okay? Some services exist, but you still have to fight to be seen. In a previous role, I was a financial counsellor, and I saw the weight of debt break people before the system did. As a former NDIS local area coordinator, I saw families torn apart trying to get help, only to be told that they were on the wrong funding stream. We're creating a system where people are punished for asking for help. And then let's talk about stigma. When I go to my local ED in crisis, I don't worry about treatment. I worry about who's going to see me. Because when Ethel from Bingo sees me in the waiting room, the whole town's going to know by that night. Even in the city, when I hand over my Medicare card and they see my regional address, I get asked, isn't there a hospital in Northam? So I lie and say that I'm visiting. And that lie, just to access care, spiked my anxiety at a time where I'm already barely coping. And after all of that, I still have to drive home. It's exhausting, and it's a choice that country people shouldn't have to make. I work as an advocate now, and that means I listen and I speak up. And what I hear again and again is that people in the bush don't feel heard. They feel judged, dismissed, and forgotten. One mother told me about her daughter, a bright, funny teenager who went through a severe psychotic episode. They were dismissed by their local hospital, asked if it was boy trouble or if she was on drugs. It wasn't boys, it wasn't drugs, it was a crisis, and they weren't believed. For years, that mother slept outside her daughter's bedroom door to make sure she didn't take her own life in the night. That young woman is thriving now, has 2 degrees, and is taking on the world by storm. But it was thanks to a city-based Headspace team. It could have ended very differently, and that family is far from alone. We're not asking for state-of-the-art facilities in every country town. We're realists. We travel. We always have. But what we need is a system that doesn't break us before we even get there. We need local peer support programs. We need outreach workers who live in our communities. We need trauma-informed training, frontline staff, people like nurses, police, teachers, GPs, and real funded pathways for regional people to lead solutions. Because if we're not at the table, we're on the menu. I've helped to build some of these solutions in my region. I started a cross-agency network to break down the silos, because something you'll always hear me say is we make silos here, we don't work in them. I helped launch an event called Turn Up in Blue, which is a mental health week event that connects people to services and shows the community that there is support available in their local area. But none of that happened because I have a fancy degree or any funding for that matter. It happened because country people care about each other, and it happened because we build community. My father's legacy lives on in me. I fight my own mental health battles every day. I do it for my kids. I do it for the next generation. Because I don't believe that trauma should be inherited and silence should not be fatal. So what do we need to do? The first thing we need to do is we need to listen. We need to stop talking, put down the microphones, and actually listen to what country people are saying. We need to fund the people that have the lived experience. I firmly believe that if you don't have the lived experience, you need to get out of the way. We need to make information easy to find and easy to understand. It needs to be in places like our libraries, our shire offices, our sports clubs. And we also need to train. We need to train the footy coach, the hairdresser, the elders, the barista, because in the bush, they're often our first line of defense. And we keep telling the truth over and over and over again until it's impossible to ignore. Regional Australians aren't asking for miracles. We're not asking for state-of-the-art facility. We're not asking for a psychiatrist in every town. We're just asking to be seen. We're asking to be helped. We're crying out for the people in the city to look east and look west and see what's happening to our farmers, see what's happening to the people in the bush, see what's happening to our FIFO workers, and understand that we're crying out every day. Because out here, silence isn't golden. It's fatal. Thank you very much.
Thank you so much, Joe. That really hit home for me, not because I'm from regional Victoria, but because I did a podcast with a girl who all the males in her family had taken their own lives. So it is something that hit home for me to hear what you were speaking about again. I'm really sorry for what you've been through. I think that what you're talking about with regional Victoria is so important, and I know that there is a lot of advocacy in New South Wales around addiction and alcohol and things like that, but that's not really facing the crux of the issue, which is what leads up to addiction, which is really, it comes down to mental health, and 86% of people who have addiction issues have underlying mental health issues. And I know with that particular person who I spoke with, her family, her father had gone to a doctor, and the doctor he's gone in there with intent and had been given a business card for a psychologist, and he went home and he took his own life.
Yeah,
So there definitely needs to be a very fast and significant response into the changes that need to happen within regional Australia. So thank you so much for
100%.
sharing. Yeah, I think your story was really important. Um, we haven't had a lot of questions come through, but there has been some really positive notes come through in the chat, which I'll let you have a read through, about saying just how powerful your words are, and everything that you do. And I imagine that what you do is completely unpaid and volunteer. And again, as an advocate, I know that that can sometimes be an uphill battle,
Yeah,
where you are constantly facing barriers of using your own time and your own resources and your own experiences to be able to try and make that change, just try and open that conversation and try and get people to listen. And the only way that these things can change is by hearing it at a government level, and that's just so hard to get to.
100%.
Yeah, so I really appreciate everything that you said. um Couple of questions have now come through. So, what do you think the biggest priority is for regional mental health?
I think honestly, the biggest priority is getting some peer support workers out in the bush.
Yeah,
Getting some people with lived experience, with real lived experience alongside the people in the bush to go, it's okay not to be okay. Because so often the reason that we see particularly men in the bush committing suicide is because it's not okay to be not okay. Um, like I said, you work, you drink, and you get on with it. And that's the mentality out here. And we need, like I said, the barista and the hairdresser and the GP and everyone who's in frontline services to have some training around this is what mental health looks like, and it's okay to not be okay.
yeah, absolutely. I completely agree. Um, if you don't have the lived experience and you need to get out of the way, that's what somebody's commented in the chat. I'm just curious as to elaborate on that. How would you go about, do you see it as an education point of view from lived experience to educate those around them about how they can approach things? So for example, I approach things with people about stigma and talking about that, and thinking that, I will talk to anybody who will listen, even if they're not listening, I'll still talk about it anyway.
Yep.
I imagine that you're a little bit like me, is that you open that conversation up whenever you can, and then that probably opens the conversation up for someone to say to you, actually, things are a bit tough. How do you find that with the people around you, when you're in a social conversation or something along those lines? How does that work for you? Do you find that a struggle, or do you find that to be quite an easy conversation once it gets going?
Look, it's easy for me. It's not always easy for the person that's listening. And that's the key thing I think about lived experience is that I know what it's like to be on the other side of that coin. I know what it's like to be in mental health crisis, and I know what it's like to not be believed.
Yeah.
So giving that person a safe space to be able to go, you know what, I felt what you're feeling. I think is a really important and key part of the overall solution is people with lived experience should be funded to be able to share their lived experience.
Yeah, absolutely. One of my favorite comments that you said was like, if you're not lived experience, get out the way. Like, that's like, I couldn't agree.
So So often we see people who, have just got out of university and they're coming out to the regional areas to do their psychology placement, and they actually don't have any lived experience. And so they get out here and they're really confronted because the issue out here is huge.
Mm.
210% more likely to attend an ED in the time of crisis than you are in the city, because we don't have access to those capture services like psychology, like psychiatry, like counseling.
Yeah.
We end up in the ED. And so it's already at breaking point there. So it's really hard for people who don't have that lived experience to deal with us country folk.
Yeah, and and there's always options for Zoom, but people just don't connect on Zoom with psychologists and with counselors and things like that. Sometimes I know personally that I don't, so I have to see my psychologist face to face, because if I'm on
Yep.
Zoom, I don't particularly get the same kind of benefit from that. And I would imagine that somebody who does live in the country is a very rural person, like you said, tough man who works all day, works all night, wants to have a couple of beers at the end of the day. They're not going to want to jump on Zoom if they know how to use it, and to try and get into having a conversation about their feelings. That's not something that can be
And
rendered.
this is the other thing. We have low tech literacy out here. We're talking, people who, used a computer at school for the first time and haven't touched one since, or use a computer to drive their tractor,
Yeah,
but don't know how to do Zoom. So it's not even about, like I said, telehealth is there. It is a service that's available to us. But what happens when you close the laptop?
yeah, yeah. You're back to being alone again. So
Yeah,
yeah, yeah, I get
yeah.
that. What would be the number one thing that Metro people can do to support regional involvement?
Scream at your MPs.
Yep. You sound
Scream
like
at
me.
your
You sound like
MPs.
me. Yeah.
Your MPs are more worried about per capita when they're talking about mental health crisis, and it's unacceptable. We have a massive crisis out here in the bush. The mental health numbers are exactly the same. We're just more isolated. It can be that we are 800 kilometers from our nearest source of help. That's not okay.
Yeah. Okay. And so I guess, leading on to another question that somebody has asked, it's not only about the funding, but it's about the community. Is
Mm.
you think that there's some kind of balance for a best outcome? So, in reality, we're not going to get millions and millions of dollars from the government. So we all tried, and they can be incredibly difficult. Is there a balanced approach that you believe could work in the back of your mind?
Look, I'm a firm believer in place-based solution.
Hmm.
So what's happening in your local area is what's most important. So if you're living in an area where, farmers' suicide is particularly high, then that's what you need to focus your time and your effort on. Um, it's not necessarily about money. Like our Turn Up in Blue Festival wasn't funded when we first started. We just got all the local community service providers in the park with their tents. The Shire very generously let us have the public liability insurance for free, and we held a sausage sizzle. And people came along and had a feed and had a chat and did all of those kind of things that we were really good at doing in the country. It's now won awards. It's a massive event. It's looking at going multi-day next year. It's just a huge turnaround, and it's breaking down stigma in our community because everybody can go along. That was the huge issue in our community with stigma. Like I talked about Ethel from Bingo. That's a real story. The names have been changed,
Yeah.
but went to the ED in crisis, got talked about at Bingo, got stopped in the street the next day. The stigma is real. So let's break the stigma. It depends on what's happening in your community. Like I said, the place-based solution is the best solution.
Yeah. Okay. I completely understand. And just having a sausage sizzle, it's like when having one at Bunnings, isn't it? Like you can get people hanging around, and like if you can get them to stick around and talk. But I know, like I know, and again, not from experience, I'm not a man, but I do understand the mental health problems amongst men is absolutely staggering. And you can understand why, because it is difficult to speak. It's difficult. Mental health in general is difficult to speak up about, but when you're speaking about it from a male perspective, it is incredibly difficult. And I deal with men in my line of work, and it can be like drawing blood from a stone to try and get some information out of them. Eventually, when you do, like, you do get that information out, and that's a real success, to kind of just like a success to hear how terrible they feel, but it gives you an opportunity to start to create options and create a safe space. And that's really important, and you need those types of things. You need those free mental health hubs and things like that in the regional areas where people don't have to pay for psychologists, and regional health hubs that do include peer support workers, um,
Yeah.
where you don't have to pay for support, but you've got someone there who has been through what you've been through or something similar, and can share that safe space, a bit like Labrina was talking about. Be able to share that space that people realize that they're not being judged, that stigma gets removed. They're okay being like to speak about it. It doesn't mean that you're going to go and talk to the police about it, or talk to an ambulance about it, or talk because there's always that fear that things like that are going to happen. And so people need to know that there is a safe space, and if there's not currently those safe spaces in regional Australia, then they need to be created, and that's definitely an important thing that the government needs to focus on.
100%.
Someone has commented on here about being from central New South Wales and with lived experience and would love to become an advocate. However, is having difficulty disclosing as I work in human resources, and this is something that I've seen before. Working in human resources, they've seen firsthand how organisations screen for mental illness and unfortunately are not hired because of this. What are your suggestions in overcoming that?
Look, it's tough to be out and proud. It's tough to be out and proud in the LGBTQI community, and it's tough to be out and proud in the mental health community. I fully understand that. It's easy to be an ally. Opt your organization into Are You OK Day. Opt your organization into an EAP program. Push for those mental health supports. If you're in HR, you've got the position to be in contact with the people who are at the coalface. You've got the people who are on the ground doing the work of the organization. Just be compassionate, be kind, treat people the way that you would want to be treated. You don't have to out yourself. You don't have to say, hey, I'm here and I've got PTSD and I'm going to change the world. That's for the limited few of us that are crazy enough to do that. If you want to make some changes and want to make some difference, just push for that compassion, push for that, those public acknowledgements, like Are You OK Day. Are You OK Day is a great one because every corporate in Australia does it. But instead of just having cupcakes on a table, make sure that there's something actually of value for your employees there.
Yeah. Yeah, I completely agree. I'm a big advocate for ruining Are You OK Day for people, so I'll go in there and be very clear
Say
about
no.
it. Yeah, exactly. It's like it's not just about today; it's about every day.
Yeah,
And I do it every year. I'll end up doing 3 talks in one day, and each of those talks will be like, it is not about today. It is about always checking in on people. If someone's having a rough day, ask them how they are, but also making sure that you're prepared for the answer that you might receive, and
that's the big one.
making sure that you're in a safe space and comfortable in how you're feeling. And it's the same as Mental Health Month, as somebody's just mentioned in the chat. It's no different. Like, we talk about these things when the media wants to talk about it, but that doesn't count for the other 10 months of the year where all of a sudden it seems to fall off the radar, and that's not okay.
Yeah,
So Are You OK is not okay to a degree. So, for everyone listening today, it's probably a no-brainer, but, speaking to people outside of those specific dates and times and months where we celebrate, everyone being all right and looking after each other and everyone being friendly at work, and, what can we do to change? It's not what we can do to change. All we need to do is be better people and to listen to what people have to say. And being in regional Australia, and again, I'm not from regional Australia, but I can understand that, that kind of environment is that if people start to have those conversations continue and they do carry on. But what is required is the backup for that, which is counselling, at a bare minimum is some form of counselling, of lived experience counselling, which is the cheapest possible option from a federal point of view.
100%.
Um,
100%. It will
so,
cost pennies to the dollar,
yeah,
pennies to the dollar to be
you,
able to actually implement something like this, and
yeah,
it just gets ignored.
yeah, absolutely, 100%. Um, so just another question that's come through. So, how can we advocate for better access for services for regional folks? I was kind of touched on a few things that we've done, but we can make sure it's on the agenda in different reference and advisory groups. So, how would you like that to be heard?
Look, what I want to see, and like I said before, we don't want to see a state-of-the-art mental health facility in every town in Australia. That's not going to happen. That's not realistic. It's not population realistic. What we want to see is on the ground supports wherever you are, whether that be the hairdresser, and I've just seen a really encouraging comment about the hairdresser thing.
Yeah,
Um, Whether that be the hairdresser or the local cop or the GP or whoever it is that's in the front line of this crisis, because it is a crisis, whoever's in the front line of this crisis, give them some training, give them some tools, put something in their tool belt so that when they get those conversations coming across their door, when they get those conversations in the hairdressing chair, when they get the conversation at the CWA lunch, um, they're ready. They're
yeah,
ready and they know where to refer people to.
yeah, absolutely. Um, Very forceful message which has come through from somebody. You ended on the word fatal, I think. Do you think
Mhm.
it's important to be forceful and indeed confrontational when you do advocate?
I do, because this is literally killing people.
Yeah.
We're losing good people to a mental health crisis that shouldn't be happening in this country. We are one of the luckiest countries in the world. And in an original version of this speech, I went through some of the funding methods and things that we have for mental health. And I took all of that out because it really wasn't. I get bored by facts and figures. Um,
I'm really good
but
at it, so just let me know, I'll help you.
beautiful, beautiful. Um, but what I realized is we have all this money that we throw at mental health in this country, but so little of it actually gets over the city walls.
Yeah,
And we miss out in the country, we miss out in the bush, and it's it's literally killing people. And I don't think I can be soft about that and be a true advocate.
yeah, yeah, I completely agree. Um, Okay, I'll give you one more question before we finish up. So, in remote communities where peer workers are likely to be known personally and their lived experience is widely recognized, how can organizations best support these workers and maintain their well-being, manage boundaries, and navigate the challenges of working with such visible roles?
Yeah, look, this is a huge one, and it's one that affects me directly because, as was mentioned at the start, I also have an acquired brain injury and I'm a disability advocate. And so I will get the wildest, most inappropriate questions come to me um, because I'm seen as a local expert. I'm a local celebrity. Everybody knows what happened to me and how it happened and all of that kind of stuff. Um, my organization is really good. People with Disabilities WA is really good in the sense that I control my caseload. And so if something isn't right, if something isn't the right fit, I will engage that person and then refer on. And one of my city colleagues will pick that up. If something is too close to home for me, again, one of my city colleagues can pick that up. But the person that's come through the door has that first warm referral point of being able to see me, a real person from the bush, who actually gives us stuff. Um, and then they get referred on to the city folk. So that's one way of doing it. Another way of doing it is making sure that your service boundaries are really clear. So not allowing for, if you're not a case management service, not case managing, for example. If you're a advocacy service, then sticking to advocacy. Sticking in your lane is really important when it comes to supporting people with a disability and supporting people in a mental health crisis.
Yeah, okay, that's great. I'm going to throw you 2 more questions and then we're done, if that's okay. I
Cool.
feel like I've
Go
got
for it.
loads of you. So, and this, kind of, it all kind of ebbs and flows into similar context, but what are the challenges that a regional peer worker faces starting a job and being accepted in their role? Now, before you answer, this is something that gets asked a lot in Metro Australia as well, and is very common. But I'm curious as to probably what the biggest challenge is.
Yeah, look, 100%. I think the biggest challenge is being believed to start with. When you're first starting, is that people believe that you've got this issue or that you've had this issue. For me, I'm pretty high functioning. I don't appear to be mentally unwell most of the time. And so it's very hard for people when they first meet me to go, hang on a second, you have PTSD. The one I get in the country all the time is that's a soldier's disease. Did you serve in a war? No, I did not. But
That
the
miseducation.
yeah, it's all about miseducation and misdirection. And the big thing is about being believed, and it's about having everything out in the bush is about showing face. So it's about saying what you're going to do and then following through and doing it, regardless of whether you're brand spanking new or a 30-year veteran in this space. Say what you're going to do and then actually do it.
Yeah, perfect. That's great. One last question for you, and it's
Yep,
literally a one-word answer for you. So, if you
beautiful.
if you could tell the government to take just one first step toward improving mental health services in your area, what would it be?
Peer support work, 3 words.
Perfect. That's great. Thank you so much. I really appreciate the time that you've taken to answer all those questions, because I've absolutely just bombarded you. But I really appreciate all the time that you've taken and for sharing your story. I think it's been
Thank you.
incredibly insightful, and that has really made a huge difference for people. I think it's been incredibly insightful for people, especially who sit in the metro area like myself, and have now learned how important it is to take control of regional Australia and the problems that you face. You probably just opened the door to a lot of people. So thank you so much for that.
Thank you.
Thanks for watching. Explore more Perspectives 2025 on Finding North Network's YouTube channel. Find out more by visiting findingnorthnetwork.com.au or email info@findingnorthnetwork.com.au.